Joining us now, former CDC Director Dr. Richard Besser. Dr. B, thanks so much for your time tonight. So help explain this all for us. I mean, we thankfully hear good news about the vaccine quite frequently now, but we know it could be months down the line for the average American. Are you worried that Americans might not actually rush out to get vaccinated once they finally do get the opportunity to get a dose, especially given that the FDA, which is now looking at these vaccines, previously issued an emergency authorization for hydroxychloroquine only to later revoke it?
Well, I'm worried about two things, Lindsay, when it comes to the vaccine. One is that we could have safe and effective vaccines and not enough people want to get those. The polling in terms of trust around this is extremely low, a lot having to do with how much politics has gone into the approval process for drugs to date. The other thing, though, that really concerns me is that there's been so much exciting news about vaccines is that many people may get the misunderstanding that we no longer need to do those things that we know will control this pandemic right now. And that's wearing masks, social distancing, hand washing, looking to limit your indoor exposure to other people. This is the most dangerous period of the pandemic right now as we go into winter when respiratory viruses do so incredibly well.
And we saw your former colleagues at the CDC come out today with vaccine recommendations for state and local officials. In your mind, what should be the role of the federal government in these difficult decisions about who gets access to the vaccine first?
Well, I think the role of the federal government is to make recommendations. The Advisory Committee on Immunization Practices that came out today with the recommendation on healthcare workers and residents of long-term care facilities, that gives a national approach. And now states will have to take their allocation and say, okay, within our individual state, how are we going to divvy that up? But so often during this pandemic, we haven't had that national standard, that idea against which all states can operate. As a pediatrician, I always look to the CDC and the ACIP, this committee, to give us recommendations around flu vaccine, around whooping cough vaccine, all of the immunizations that we give to children, we give to adults. The recommendations come from this committee.
And finally, the CDC reduced, as you know, its quarantine guidelines today for those with possible exposures but had a negative test to 7 days and 10 days without a test, with record cases and hospitalizations surging. Do you have faith that this decision was based on sound science? And if so, would you say that this is also an admission then that many Americans were turning their lives upside down for days at a time when they really didn't need to?
Well, I think, if you look at that tail of what happens at 10 to 12 days or 10 to 14 days, that end period, that's a period where, yes, it is still possible for someone who's been exposed to develop symptoms and become the ability to transmit to other people, but it gets much smaller. It's also a recognition, I think, and it's a sad recognition, that Congress has not given people the resources they need to be able to quarantine, to be able to isolate and not lose their jobs. Not, to the idea that you're going to stay home for 2 weeks and not be able to put food on the table or pay rent, that is unconscionable. And if Congress doesn't put the dollars out there, we're going to see fewer and fewer people willing to say who they had contact with, willing to do those things to reduce transmission.
Dr. Richard Besser, thanks as always for your time.
Thanks, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.